So good day. I'm going to perform today securing informed consent for chemotherapy. Okay, so this is our patient Jenny. Okay, good day, ma'am. I am Mary Jo Mendoza Servida, student nurse from the College of Maasin, and I am your attending student nurse for today. And I'm going to ask for your informed consent for your chemotherapy tomorrow at 9 a.m. Would that be okay? Okay. Now, ma'am, may I ask your name again, please? Okay, thank you. So, ma'am, I have questions to ask. Would that be okay? Okay. So, do you know what is chemotherapy for? Okay. Ma'am, so chemotherapy is the use of anti-cancer drugs. It can be taken through mouth or injected into your veins in under the skin or in the cerebral spinal fluid. Chemotherapy is the main treatment for most people with acute myeloid leukemia or your blood cancer. And intense chemo might not be recommended for patients in poor health, but advanced age by itself is not a barrier to getting into this treatment. Okay. Now, ma'am, I would explain how is chemotherapy given. So, it is usually divided into two phases for your condition. It is the induction and the consolidation phase. So, the induction phase is the first phase of treatment. It is short and intensive, typically lasting about a week. The goal is to clear the blood of leukemia cells and to reduce the number of blasts in the bone marrow to normal. Okay, for consolidation, it is a chemotherapy given after the patient has recovered from induction. It is meant to kill the small number of leukemia cells that are still around but can't be seen. For consolidation, chemo is given in cycles, with each period of treatment followed by a rest period to allow the body time to recover. Now, ma'am, I'm going to explain to you the two types of chemotherapy drugs that are going to be used for your condition for your acute myeloid leukemia. Okay, ma'am. Cytarabine and azacitidine are two chemo drugs used most often to treat acute myeloid leukemia or your blood cancer. And I'm going to explain each of these medication. So, cytarabine is a chemotherapy medication used to treat acute myeloid leukemia or your blood cancer. Its side effects would be high doses of cytarabine can cause dryness in your eyes and effects on certain parts of the brain, which can lead to problem with coordination or balance. Drug dose may need to be reduced or stopped together if these side effects appear. Now, for your azacitidine, it is believed to work by helping your bone marrow grow normal blood cells, so you will need fewer blood transfusion. So, side effects of azacitidine would be redness, pain, or bruising at the injection site. It could also be tiredness, diarrhea, dizziness, trouble sleeping, constipation, nausea and vomiting, mouth sores, dry skin, headache, and loss of appetite may also occur. So, ma'am, for your nausea and vomiting, it can be severe. In some cases, your provider would prescribe medication to prevent or relieve nausea and vomiting. So, some interventions for these condition would be eating several small meals or not eating before treatment or limiting activity, which may help lessen some of these effects. If these effects last or worsen, you could tell your doctor or your pharmacist immediately. So, ma'am, I would explain also some other possible side effects. These chemotherapy drugs could also affect other organs that could be damaged by the chemotherapy drugs. It includes the kidneys, livers, ovaries, and lungs. So your health provider would carefully monitor treatment to limit the risk of these side effects as much as possible. If serious side effects occur, the chemo may have to be reduced or stopped, at least for a short time, and careful monitoring and adjustment of drug doses are important because some side effects can last a long time. Okay, ma'am, to summarize, all in all, chemotherapy is the best treatment possible for your condition, acute myeloid leukemia or your blood cancer. These drugs can kill or inhibit the growth of cancer cells, but it would also affect these normal cells left. But rest assured, your healthcare provider and its team would monitor your health status so we can prevent these side effects and manage discomforts. Okay, now, ma'am, I'm going to show you some videos on how to do chemotherapy. Would that be okay? Okay, now please watch this. Okay, thank you. After everything we have discussed, um, may I know any concerns? Okay, would you like this treatment, ma'am, for your condition? Okay, ma'am, are you willing to take those medication to treat your conditions, or would you like some alternatives for it? Okay, ma'am. May I ask, what do you know about chemotherapy now? Well, that's great, ma'am. Now that you've known all about the chemotherapy treatment, now I would officially ask for your consent to perform that treatment. Okay, now, ma'am, I would like you to sign here. And by signing here, it is known that you are well informed and you are allowing this kind of treatment for your condition. Now, please, thank you, ma'am, for your preparation for today. This consent form will serve as our legal document to verify that you agreed to this kind of treatment for your acute myeloid leukemia or blood cancer condition. Thank you for today, ma'am. Have a pleasant day. And if you have any concern, please do not hesitate to call me or the other healthcare staff. Thank you.